In this video, I'm going to show you what your tongue reveals about your health. You use it almost constantly, but often do you really look at your tongue? While many of us probably don't make tongue examinations a daily thing, you'd be surprised at how much you can learn from regularly checking yours out. Your tongue, like every part of your body, is very clever at notifying you if something's wrong. This might be in the way it feels, but more often than not, it'll change in appearance. If you can get into the habit of checking your tongue, as well as being aware of the potential warning signs to look out for, you'll be helping yourself to stay healthy into the future. You should also consider using tongue scrapers and brushes to help keep your tongue in the best shape. Click here to find out more information about these. So if you're curious to learn what your tongue can reveal about your health, stay tuned to find out. Number 1. A pale tongue could be signaling a cold or iron deficiency. Your tongue should naturally be pink in color with a thin white coating. If it's looking too pale, almost bloodless in appearance, chances are you're suffering from a viral illness that's making your body temperature drop. Aside from illness, you may also feel cold if you're fatigued or if you need to nourish your blood. Try eating warm foods to combat this, and take ginger supplements for extra support. A pale tongue that's dry in texture is also a sign of an iron deficiency. Luckily, it's easy to increase your iron take via supplements or the foods you eat in your diet. Tofu, spinach, dark chocolate, lentils, eggs, oyster, and broccoli are all great sources of iron. Number 2. Cracks in your tongue could mean a hormonal imbalance. You'll normally find that if your tongue is showing cracks on its surface, you've probably got a vitamin deficiency caused by a hormone imbalance. Hormonal imbalances occur when there's too much or too little of a hormone in your bloodstream. Because of their essential role in the body, even small hormonal imbalances can cause side effects throughout the body, and a cracked tongue is a common sign that something's not right. If you think your hormones are off balance, there are a number of ways to naturally treat the issue. It's best to speak to your doctor first for a professional diagnosis and treatment plan. Number 3. Teeth marks in your tongue could mean spleen issues or anxiety. If you notice teeth marks on the surface or the sides of your tongue, it's known by professionals as a scalloped tongue. Scalloped tongue gets its name from the wavy indentations that you'll see along the edges of your tongue, and is usually caused when your tongue swells or becomes inflamed. This is a sign that your tongue is damper than it should be, which suggests you may have an issue with your spleen. If your spleen isn't working poorly, you might also notice that you're more tired than usual and you're experiencing digestive issues. Aside from spleen issues, anxiety can sometimes cause you to press your tongue against your teeth. If you do this quite regularly, you'll eventually leave indentations. In both cases, it's advised to speak to your doctor to help solve the underlying issue. Number 4. Large, puffy tongue indicates a poor diet or hyperthyroidism. A buildup of dampness of the tongue can cause puffiness and swelling. This isn't usually a serious sign, rather an indication that you're not eating the right sort of diet. Try to add more fruits and vegetables into your meals. Home cook where you can, and stay away from greasy foods. Occasionally, a swollen, puffy tongue can be a sign of hypothyroidism. This is a thyroid disorder that's characterized by low levels of the thyroid hormone, which can lead to symptoms such as hair loss, fatigue, easy bruising, and lower blood pressure. Speak to your doctor for more information and a medical diagnosis. Number 5. Shape changes in certain areas can mean problems with the liver, bladder, spleen, stomach, and heart. Your tongue may change color, texture, or shape in a number of different locations, and it's important to know which area indicates what. Generally, if the very back of your tongue changes in shape, you may have an issue with your large and small intestines, as well as your kidneys and bladder. The side areas of your tongue are linked to the liver and gallbladder, while the center of the tongue is associated with your spleen and stomach. If the very front part of your tongue has changed in shape, this may indicate that you have an issue with your lungs or heart. Number 6. Red or white and blotchy tongue can be caused by too much heat or oral thrush. A dry or red tongue with no thin white coating is usually a sign that there's too much internal heat in your body system. This might be caused by dehydration, especially if you're noticing red splotches that have an almost peeled appearance. The solution is simple. Drink more water and cook with healthier oils, like olive oil and coconut oil. White spots on your tongue, on the other hand, could be a sign of oral thrush. A fungus called candida causes oral thrush, otherwise known as oral candidiasis. This fungus will present on your tongue as creamy white patches, sometimes with red areas. These patches can appear on your tongue, but look out for them on your mouth or throat too. Number 7. Inability to taste foods properly can manifest itself because of cancer therapy, cold, or flu. If you're struggling to taste your foods properly, you most likely have something called dysgeusia. A number of factors can result in dysgeusia, including certain medications and cancer therapy, as well as a dry mouth, gum disease, and a simple cold or flu. Cancer therapy involves chemotherapy and radiation, especially can affect your taste buds' response to food. It's also common for smoking to affect your taste. Dysgeusia tends to only be temporary and should resolve once you've eliminated the cause. So if you are smoking, it's time to stop now. Number 8. Bluish-purple tongue shows blood stagnation or a cold. If your tongue has bluish-purple spots along the edges, it might be due to something known as blood stagnation. This is a condition which causes the slowing or pooling of blood, which can lead to pain and other symptoms. This particular shade of purple would almost look blue, like the color of the veins in your wrist. If your entire tongue is bluish-purple in appearance, you might just be suffering from a standard viral cold. Make sure you see your doctor if you're concerned it might be something more serious. Number 9. A pale purple tongue could be the result of a cold, respiratory illness, or heat. A pale purple tongue is usually an indication of a cold, although if your tongue is dark purple, it may again indicate blood stagnation. A crimson purple tongue suggests that your body temperature is higher than it should be, especially if you're also experiencing dryness of the mouth. In this case, drink plenty of water and make sure to stay hydrated, and the issue should clear up on its own. If your tongue is pale purple, it might be linked to a respiratory illness. Work with your doctor to treat the underlying cause and reevaluate your diet if you think it may be contributing to your current state of health. Number 10. Bright red tongue may be due to a hormonal imbalance. Heat, digestion issues. A tongue that's bright, almost strawberry red, is another indicator that you may have a hormonal imbalance. It could also be telling you that your body temperature is too high, which might be caused by not eating the right healthy foods. Inflammation or digestion issues can sometimes lead to an increased body temperature, as well as common colds and flus. Try eating cooler foods to resolve the issue. If your tongue is red, it could similarly mean that heat isn't flowing properly around your body. Make sure to regularly exercise, dress accordingly, and stay hydrated to keep heat moving in and out of your body and ultimately regulate your body's temperature. Number 11. Hair on the surface of tongue shows poor oral health, Epstein-Barr or HIV. One of the rarer changes to your tongue presents as a surface coating that has the appearance of black, brown, or white fur, which is known as hairy tongue. Those hairs are not actually hairs, but long strands of proteins that catch food and bacteria over time. Usually, hairy tongue is simply a sign of poor oral hygiene, and you should find it goes away naturally when you brush or scrape your tongue. However, if you notice that your patches of hair are white in color, and you're struggling to scrape them off, you might have something called oral hairy leukoplakia. This is usually a result of a viral infection like Epstein-Barr, a type of herpes, or even HIV. Number 12. Black areas of the tongue is normally due to smoking or antibiotic use. A black tongue is usually nothing to worry about. You'll often find that it's a result of a buildup of dead skins on your papillae, the tiny areas of your tongue that contain your taste buds. Some of the most common causes of a black tongue include the use of some antibiotics and smoking. If you have a black tongue, it's normally accompanied by some surface fuzziness or hairiness. It may also be accompanied by bad breath and a metallic taste in your mouth. To treat a black tongue, you usually only need to brush your tongue regularly with a normal toothbrush and cut down on your smoking habit. Number 3. Burning sensation can be caused by a dry mouth, infections, diabetes, acid reflux. A burning sensation in your tongue and mouth can be a sign of all number of health issues. If your tongue feels like you've scalded it on a hot drink and tastes metallic or bitter, you might have something called burning mouth syndrome. This could suggest an issue with the nerves in your tongue, but can also be a sign of health problems like dry mouth, infections, acid reflux, and diabetes. So how can you check your tongue for these conditions? Examining your tongue need only take seconds of your time. Try to make it a part of your routine, like brushing your teeth or combing your hair, so that you're less likely to forget. There are no secret or difficult elements to checking your tongue. Simply stick it out as far as it'll stretch and stand in front of a mirror. Lean in close for a better view and check that everything looks healthy. Generally, if your tongue is sort of soft pink color with a thin white coating, it's healthy. Look out for any of the signs mentioned in this video, and if a particular area is painful, investigate further. To conclude, ultimately you should make a visit to your general practitioner if your tongue is displaying any unusual symptoms, especially if pain is involved. Your tongue is a part of your body that you shouldn't notice even while it's working. So if it's on your mind for any negative reasons, it's best to do something about it. Your tongue really is cleverer than you give it credit for, and it's important to look after it for the sake of your overall health and well-being. Make sure to brush it regularly to maintain good oral hygiene, using a tongue scraper if necessary, and drink plenty of water to help wash away any excess bacteria. Make regular dental appointments and speak out if something doesn't feel right. If you want to know where to buy the best tongue scrapers, then click here. I hope you've enjoyed this video on what your tongue reveals about your health. If you have, please subscribe to this YouTube channel and don't forget to give this video the thumbs up. And I'm sure you're going to enjoy this next video on the 15 signs and symptoms of foot problems and what they reveal about your health. Thanks for watching, and bye for now.